Hello everyone and welcome to this important segment of our OSCE training. Today we'll be looking at one very important topic. Why is it important? It's because we all want to know what makes people or other students fail, so that we could always avoid those pitfalls. This video is captioned Common Pitfalls to Avoid in Your OSCE Preparation. My name is Nurse Emmanuel and I'll be your facilitator for this session. So we'll be looking at some common pitfalls that you should try as much as possible to avoid as you prepare for your OSCE. The first one is hand hygiene. Okay, so it's very, very important that you wash your hand before and after each station or every procedure that you do. As a matter of fact, if you touch your patient or your documentation without hand hygiene, your assessor can just stop you immediately and it's automatic fail. So please, as much as possible, try not to forget this important process, important step in your OSCE. So the first one is hand hygiene. The number two is forgetting to check for allergies. As an OSCE trainer myself, I have seen a couple of students in the past that, just come out of the exam hall and just remember that they forgot to mention allergy. And unfortunately, I know those people, they have to go back to write those stations. So please know that even though it's not all the OSCE stations that request or require you to mention allergy, but a good number of those stations request that you should mention allergy. So please ensure you ask your patients about allergies. It's very, very important. Most importantly, in your assessment station, implementation station, evaluation station, and any other station that has to do with medication like suppository, IM, and those stations. So asking of allergies is important. Going forward, number 3, we have inadequate patient identification. If you look at the matching criteria for most of these stations, you are expected to introduce yourself as a nurse. Okay, that's one aspect. Then you introduce the patient, will introduce his or herself to you. How? By either using the patient's full name and then their date of birth. Now, but this is where the problem is. In the hospital settings, we have what we call the wristband. Okay, the wristband. Now, all patients in the hospital have wristband. So when you are asking the patient for their ID or their information, you have to look at the wristband, okay, and then compare it with your own paperwork. So your assessor will be looking at you to see if you are doing all of that correctly. So you have to look at the patient's wristband, okay, and then look at the paperwork as the patient is talking. Then you also cross-check that what the patient had said is correct. So inadequate patient identification can actually lead to a serious problem, which we're trying to avoid. Number 4 is not gaining consent. Now, as simple as this may seem, it's just like entering somebody's house without knocking. That's what it means. So when you do any procedure without seeking for consent, it's obviously going to affect you. So we don't want that to happen. So please always gain consent. And gaining consent is different from explaining the procedure to the patient. For example, if I'm to do assessment, for example, and I come to the patient, I say, my name is Nurse Emmanuel and I'll be your attending nurse for today. I'm here to do assessment for you. This will last about 15 to 20 minutes. That is explaining what I'm about to do. It's different from consent. Consent now is it okay if I proceed? That is not consent. So don't mix explaining what you're about to do and then gaining of consent. I hope that is clear. So that is not gaining consent can be a big pitfall. Try to avoid it, please. Then number 5 pitfall that you should avoid is overlooking aseptic technique or just ignoring aseptic technique. Okay, and this is very, very important, particularly when you are to do IM or ANTT, those 2 stations, or even subacute, those stations that require some form of aseptic technique. Don't just disregard it and say, oh, it's not important. It's important. As a matter of fact, in your ANTT, try as much as possible not to contaminate the sterile field. And if for any reason you mistakenly contaminate the sterile field, please correct yourself immediately. Please do not say, no. Correct yourself immediately and let the assessor know that it was a mistake. Correct yourself, please. So that is number 5, overlooking aseptic technique. Number 6 is missing documentation, or I'll just term it documentation. Now, documentation has different aspects to it. Now, the first one could be not documenting at all. Maybe you run out of time, you're just doing your procedure and then you run out of time, so that is fail automatically. And then another one could be incomplete documentation. You're meant to sign and put a date, and then in the process you sign and just about to write the date, the examiner said time up. It's still incomplete documentation, it's still fail. Then, or inappropriate documentation. This is common in your implementation station, where you go and sign on a different medication. Let's say you are meant to give a particular medication, let's say amoxicillin, for example, and then you have amoxicillin, and then you have another medication, antibiotic, let's say clarithromycin, for example, and then you're meant to sign under amoxicillin, you went and signed under clarithromycin. That is inappropriate documentation. That is also fail. So please ensure that while you are practicing for your exams, your OSCE exams, you use the appropriate NMC sample materials to practice, and practice with time. And within this time frame, try to do the documentation. Ensure that it is done well. Okay, so that is about this documentation, which is number 6. Number 7 is inappropriate prioritization in plan. This is actually in planning, when you don't prioritize your patient needs appropriately. Let's say, for example, now you are having a patient in your API that has pneumonia, for example, and this patient comes into the hospital with serious breathing issues, dyspnea. Let's say the respiratory rate was 28 or 20 something, and then the chest is not clear, there's wheezing sound and all of that. And then you also complain of pain, for example. You also complain of pain. Now, obviously, you will know that by order of priority, the breathing should come first before the pain. But if you now put pain before the breathing, that is inappropriate prioritization. That could affect you. You know, I've seen in the past some people in the past that have had issue that had to come back to write their planning station because of this issue. So please try and avoid this. Then, in addition to this, under planning, ensure that you always document your dates and signature, please, and then your name. And I always recommend do that before you even start writing. You know that the planning station is just a 14-minute station, okay? And you're meant to write 2 nursing problems. So if for any reason you run out of time and then you've signed in the first page of the planning, and then just about to sign in the second page, you run out of time, you will still fail. It's not going to be your portion. But please, to avoid that, always write your details, your name, signature, and all of that before you even start your exams. Okay, so that is number Number 7, okay, inappropriate prioritization and documentation. Number 8 is being too robotic or memorized. This is when you've already crammed everything that you want to say, and then it looks as if you are using a script and not following the flow between you and your patient. That could affect you. In fact, your examiner could begin to feel that you are cheating. So try as much as possible to involve your patient and flow with the conversation. Don't come up with a crammed script in your head. Okay, then number nine pitfall that you should avoid is failure to escalate appropriately. And this is usually common in your assessment. In your assessment, under your Institute chart, there's a place where there's a column where you meant to either escalate or not to escalate. So that is very, very important. There are cases you need to escalate. So where you need to escalate and you fail to escalate, it can affect you drastically. And this also applies to evaluation, okay, because you are meant to use the S-bar technique, and then the R part of the S-bar is recommendation. So always escalate cases that needs escalation. Escalation could also mean referral, okay? Also mean referral. So try to refer issues that needed to be referred, please, but not just refer to the right specialty. For example, it would be wrong to refer someone with cardiovascular condition, say you are referring them to a dietitian. That would be wrong, okay? So you refer somebody that have nutritional issues or appetite related problem, not eating, to a dietitian instead. So something like that, okay? So that is failure to escalate appropriately. And then the last but not the least, number 10, is not practicing realistically. Not practicing realistically. So not practicing realistically could mean you are just assuming that the scene or what you are doing is not real. Okay, and this could mean, for example, when you are using a mannequin and you begin to rough handle the mannequin, or you begin to do things that hurt the mannequin, because you are going to assume that anything you are doing is real. Okay, so when you are dealing with a mannequin, you have to assume you are dealing with a real human being. So all of these are things that you should put in mind as you prepare for your OSCE. These are pitfalls, even though we still have other pitfalls that have to do with specific stations. So to wrap my class up, I'll run through them again. The first one is hand hygiene. Not doing your hand hygiene could be a very, very big pitfall that you should avoid. Always do your hand hygiene before and after. Then forgetting to do your allergies also is a pitfall. Inadequate patient identification is another one. Not gaining consent is number 4. Overlooking aseptic technique is another one. Missing or basically documentation related issues is another one. Inappropriate prioritization, being too robotic, failure to escalate properly, and the last one, not practicing realistically. So these are the pitfalls that you should avoid as much as possible in your examination. And in addition, if you need any assistance, please, there's the contact on the screen. Please, you can reach out to us for any assistance. Please, if you like this video, you can subscribe to our channel so that you'll get notified when we upload similar videos. And if there is any other aspect of the OSCE that you're struggling, that you need assistance, just drop it in the comments, and then we will ensure